Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer some questions about why and maybe when we might need anesthesia for your cat.
So, Dr. Lucas, what's anesthesia?
Anesthesia is when we take the conscious mind and basically put it into unconscious so that we can do some things to the body that may be uncomfortable and not have the brain perceive that discomfort.
And why would I need my cat to be into anesthesia?
Well, oftentimes we use anesthesia, especially when we're going to do something uncomfortable, which is usually surgical, or we're going to do something that might impact their airway, which is like dentistry, and we're using a lot of water, and we want to protect their airway. And we need them to be very still. Maybe we're going to evoke anesthesia if we need to set a fracture, something that might be painful to that cat. Those would be reasons that we would often use anesthesia.
What's the difference between anesthesia and sedation?
So sedation, pets still have some voluntary motor ability and some consciousness, and reflexes would still potentially be intact depending on the level of sedation that we have them in.
So what do I need to know before my cat goes for an anesthetic procedure?
So some things that you might want to consider before your cat goes under general anesthesia is what is going to be done for the safety of that animal while they're under anesthesia. So who's going to be monitoring them, what safety precautions are in place. Will your cat have an IV catheter? Will your cat be intubated? Where is it going to be held until anesthesia? Where is the cat going to be in recovery? How can I get my cat safely to the hospital before anesthesia? Do I need to do any medications before? So there's a lot of questions to be asked regarding cat anesthesia, and so you need to have those conversations with your veterinarian.
What are some possible complications of anesthesia my cat could experience?
So that's probably the biggest concern that pet parents have, and also veterinarians work very hard to mitigate those risks because those risks are real. General anesthesia is taking a cat and putting them completely under anesthesia, and they're unconscious, they're immobile, so that changes their physiology, changes their heart rate, changes their blood pressure. There are true risks with general anesthesia, so those are going to, again, be something that you're going to talk with your veterinarian about. It's probably the biggest hurdle that we as veterinarians have to kind of walk with clients through is their worries about the risks of general anesthesia. So we are all trained to put cats under general anesthesia, but you have to be comfortable and trust your veterinarian. And here at Blue Oasis, we actually allow your cat pet parent, so you, to stay with your pet during general anesthesia procedures so that you see all the things we're doing for the safety of your cat, and also you're able to be with them while they're going under anesthesia and then coming into recovery so that you're there to comfort them.
What kind of aftercare should I provide as my cat is coming out of anesthesia?
So really, that's as your cat is coming out of anesthesia, you're really not going to be very involved with that because that's going to be the trained professional nurses and the doctors that are going to be helping that cat sort of come back from unconsciousness to consciousness. That can be a little bit of sort of volatile time. It can be a real relaxing time for the pet, but there's also sometimes the brain just comes back online very abruptly and comes back to consciousness. And so we need to be prepared for that fight or flight in some patients. So we as veterinarians are going to be very carefully monitoring your cat as it comes out of general anesthesia and be there to gently get it back into recovery so it can go on with its healing process. So general anesthesia is a big sort of topic to cover, so we're going to do some more videos and answer some more questions. So if you have questions about general anesthesia, especially for your cat, we really encourage you to talk with your veterinarian about your concerns. Thank you.